Hello, my dear MDS aspirants. Dr. Amit Lall once again this side. As promised, let us discuss the ugly truth about how to become rich, famous, and successful after doing MDS in orthodontics. So, all those who are planning to do MDS in ortho in the upcoming year, please do not miss this video. The logic is very simple. Orthodontics is one of those branches of dentistry which can be considered almost exclusive in terms of doing a specialty practice in the long run. What does it mean is ortho is one of those branches in which you need not to get worried about what to do in general dentistry. It's like once you have become an orthodontist, you are something like a super specialized guy who is going to treat all the malalignment possible in the teeth of children and adults. So you are not to be worried about what is happening in the RCT, what is happening in the restorations, what is happening at the other ends of the dental oral cavity. You need not to be worried about. You can easily work exclusive ortho as an exclusive orthodontist and earn mint money, whatever is possible. This is one aspect. The settlement starts with a very simple thought. Once you do ortho, you have to be really good in knowledge. Ortho is a branch which is involving less of skills but more of intellect. Okay, it is more about treatment planning. The treatment can be done even by a technician, but that's not the case because orthodontists are highly specialized people. I always respect the branch because it is mainly, you can say, made for those who are of super brainy sort people. Okay, so that is the difference. That makes you a different orthodontics. Once you see malaligned teeth after becoming or doing ortho, you visualize how the teeth are going to look and how they are going to go back in the oral cavity. If it is a Bimax protrusion case or anything, what you are doing malalignment treatment, you are the best person who can visualize the final outcome of the treatment. Then comes the planning, what you will do, what you will not do, and how much time it will take. It is a long treatment plan which is not a cup of tea of any person on the planet. You can say it is the only branch in which the treatment goes for months and maybe years. Rest every branch treatment usually finish off in hours or days or weeks time. That is the ultimate, you can say, the difference between the branches. Now, how to become rich, famous, successful once you pass out? It becomes a challenge. Number one, you have to accept this fact. The clinics surrounding you, wherever in whichever city you are, tier 1, tier 2, tier 3 city, the clinics, there is some orthodontist guy or girl visiting already. So it's very difficult to replace that person, and it takes a hell lot of effort. You have to do a lot of PR, you have to meet people. That's what advice I give to all the passing orthodontists, my students, every year. Make good business cards, good LinkedIn profile, good Facebook, Instagram presence, and start spreading the word. Visit each and every clinic for consultation. Drop your card, drop your maybe some biodata or something good which you makes you a different person. Talk to the clinic owner. Definitely there will be some negotiations on the prices and all. You should be well versed with that. It takes time to start with 1 clinic, 2 clinic, 3, and there will be a time in 1 or 2 years when you don't have time for a new clinic. But for that first 2 years, you have to do a lot of hard work. Now here comes the catch. This task is little, you can say, difficult for the girls to roam around in different clinics. It's not like, please don't judge it on feminism issue. It is the practicality what I'm talking about. The girls who are opting, yes, many girls opt for ortho because they have some love, passion for the branch. They become, you can say, they rise in the field through their own clinics. Maybe before marriage or after marriage. I have seen a lot of dental couples in which the wife is an orthodontist, and in our team also, Dr. Sagar Garg's perio faculty wife is an orthodontist, and she does phenomenal ortho in a tier 2 city called Agra. She's doing a lot of cases in her own clinic, plus based on the reputation she has earned, she's doing a lot of cases in nearby 2-3 more clinics, and that makes her a good, you can say, occupied with a lot of good time. So, but the boys, on the other hand, you have to struggle a bit to make your own presence felt. You need to have 5, 10, 20 clinics in hand over a period of time. But yes, opening a clinic for an orthodontist is a big challenge. Your mornings are going to be very dull, dry, because major patients are children, adolescent, college students. So mornings are really, you can say, free time. Then if you start your own clinic, you will have to face challenge of general dentistry. Orthodontist is probably the only postgraduate passing out in, like, most of the colleges. You are not allowed to do general dentistry when you are doing MDS in ortho, but some colleges do allow. So when you are sitting in your own clinic, you will face a lot of challenges of pain management and other things. Maybe you are the only person who feels afraid of even injecting. That's what my orthodontist used to tell me in GDC Mumbai. Okay, I won't name the guy, but he used to tell me, like, after 3 years I am not even comfortable injecting LA into my patients. But that is where the void you need to fill up. You should learn to do your own extractions. That's what AIMS orthodontist people are doing. You, any ortho case you are going to deal, try to do your own extractions. Try to keep like little bit hand on basic restorations. That will make you rise in the field like better than others. See, you have to be little different. You have to be little more advanced when it comes to your own field. You can't be just retrogradely like going back that I will not do this, I will not do that, and then that is not going to make you rich, famous, and successful. That's not the approach. Ortho was facing a tough time, but yes, ortho is the longest. You can say it is the branch which will never die, because any day and every day people are going to have malaligned teeth. With evolutionary changes, jaw sizes are going small. Malalignment is bound to happen. You are the people who will stay forever in the industry. There was a time when orthodontists was struggling because of the long treatment plans, less payout, but then suddenly invisible braces, Invisalign type concept came, and now there is a boom. See, the branch which is going to stay for long, definitely the evolution in the branch will also come. Like in prosto, evolution came, it's still growing. It's like innovations are happening. Same happened in ortho, like digital smile designing in ortho is an integral part now. Invisalign is an integral part. Likewise, in future also something new will definitely add up, so it is never going to end. So all those who are looking for ortho, without doubt, you should go ahead with it, and you are going to make money with that. But yes, in last few, like you can say 1 decade, when ortho was facing a tough time, what I have seen and experienced was many orthodontists even did implant courses, and they are doing a lot of implants. The reason is very simple. They had time to learn in the mornings. They had free time to practice any new skill. Secondly, they had a good consultation network. They were already going to 10, 20 different clinics, which out of those, say around, you were going to 20 clinics, out of the 20, 10 invited you for implants also. So you already had a consultation base ready for you. So all those who are in tier 1, you have to struggle for 1 or 2 years. Tier 2, tier 3, spread up your wings, start moving out 30, 40, 50 kilometers, and you will find clinics for yourself. But it takes time. Don't be disheartened once you pass out of ortho. It takes time, but it is going to pay you rest of your life you cannot imagine. Okay, so all the best for all those who are going to opt for ortho. Have a great day. Keep watching this place for more such videos. Thank you. Good day.